here at Diem Technologies. We're really glad you're able to make it today. First off, I wanted to say that we want to be respectful of your time, so I'm going to jump right in here so we can get this webinar in a reasonable amount of time. Today's webinar will focus on the role of secure docs and fax in healthcare. Joining us today is Greg Horton from OpenText, and Greg is a subject matter expert on all things fax in healthcare. He really knows his stuff, and I think you guys will find it really a valuable presentation. Q&A will happen at the end of the webinar. If you have any questions during the webinar, you'll notice off to the right side on your GoToWebinar chat window that there's a question section. So feel free to submit any questions for us, and we'll hit those at the end. Greg and I can answer those. At this point, I think we'll jump right in. I'm going to turn it over to you, Greg, and welcome.
All right. Thanks, Kent. Welcome, everyone. My name is Greg, and I do work for OpenText, and I want to talk a little bit about health information exchange in the healthcare space. We're going to start actually by talking a little bit about data breaches and the exchange of healthcare information and some of the issues around protecting that. So here's some data that came from the Health and Human Services Office. They're actually the government agency that's responsible for enforcing the privacy aspects of HIPAA and high tech. And so they were looking at breaches that had been reported in the first part of 2012 and looking at what the sources were. So they found 45 of those involved paper, 9 of those a network server, 8 they put in the other bucket. I'm not sure quite what that was. 6 were network servers plus some hacking or IT incidents. 5 were involved email, and 3 involved electronic medical record. And these are issues where there's unauthorized access and disclosure of protected health information, PHI. And so I'm going to refer to that as to PHI throughout this presentation. And that's really what we're concerned about, is how do we communicate protected health information in a way that is compliant with the law, protects people's privacy, and yet improves the quality of health care. Now, when they looked at these breaches, the Health and Human Services Department sort of talked about the areas that they investigate most often when it comes to the release of PHI. And so some of it is about impermissible uses and disclosure. This is the case where someone discloses it on purpose, but it may not have been allowed under the law. They also investigate lack of safeguards where people aren't protected adequately, or lack of patient access. There happens to be a part of HIPAA that says a healthcare organization must provide a patient with access to the information that is stored about them within 30 days of a request. Also, they investigate cases where there is a reason to disclose some protected health information, but much more than is needed is shared. And finally, they investigate the lack of administrative safeguards. Now, breaches are expensive. There are significant fines that are levied by the Health and Human Services Department, and you can be fined for unknowingly violating HIPAA. And in fact, if you knowingly violate HIPAA, you can be imprisoned. And so this data is sort of some averages based upon some of the information that's been released on breaches. Notice the average cost per data breach is $5.5 million. Now this includes, notice they say the average cost per healthcare breach per record is $240. And basically a lot of that goes into most breaches involve a healthcare organization paying for some sort of identity theft protection for people whose data was revealed. And so if you take the number of records times 240, add some attorney's costs in there, you get the average cost per breach being about $5.5 million. There's also fines. So that 240 isn't just about fines, but it's about the expense of taking care of the people whose data you've revealed. The government can fine you $25,000 per violation. I believe that is actually a per record sort of thing. and $1.5 million is the annual maximum. To our knowledge, over 260 million records of all types have been breached, and I apologize, the cents is missing, and I don't remember the year, but it's not very many years. It's only within the last 3 or 4 years. So let's give us some examples, and I pulled some examples that involve different kinds of storage or communication methods. So the first one was email. In this case, fairly innocent breach in terms of the manner in which it was done. Basically, a benefits staff member, sent an email to employees that had some data about individuals in their dental plan, I believe. About 700 names were affected, but this email went to 85 people. Right? These people did not need to receive the names and birth dates and social security numbers and marital status of all these people in this email. So basically an accidental distribution. Still, because more than 500 people are involved, Johns Hopkins was required by law to report that this happened, and not only required by law to report to the government, but actually to report to the public as part of HIPAA. So within 5 days, all the recipients were notified that email was deleted from the servers and from people's accounts. But, I mean, a very simple mistake resulted in a potentially expensive breach. Another example involving fax. Now, in this case, this was a deliberate sort of breach where a volunteer at the University Medical Center who worked in the emergency department was faxing what they call face sheets, which are sort of high-level information about the person, their address, their date of birth, the social security number, and a diagnosis as they come in, sort of the triage guess of what's going on, was faxing this information to an attorney, right? So the attorney could follow up with these emergency room patients to see if they needed to sue somebody. They believe that this went on for years. And in fact, as a result, they think maybe 5,300 people have their information sent to this attorney. And in this case, this person, because it was a deliberate breach, this person has been indicted and can go to jail for disclosing this information. Now, we'll talk about some of the issues around that with fax in a minute. Last example, this was an external hard drive. It was stolen. It had electronic protected health information on it of 2,700 individuals. It included a lot of information, including some test information, some social security numbers. And you know that today it doesn't take much more than a name, an address, a date of birth, and a social security number to steal someone's identity. And so these breaches are taken very seriously. Now, early in 2012, OpenText sponsored a survey with Healthcare IT News talking to healthcare providers about communicating PHI, about their document storage, how they implement new technology. And so this is just one slide, some high-level results from that. We had 288 respondents. 73% of the people who responded didn't feel like their document management was extremely secure. Some of them thought it might be a little bit secure, but not extremely secure. 42% lacked resources to implement new technology. So they knew they needed stuff, but they just didn't have the resources to implement some of the things they needed to do. 32% didn't integrate their fax with their EMR or other back office applications. That's very relevant to what we're talking about today. And 25% said security was their greatest challenge when it came to managing document delivery which is what we're going to talk about with fax. 20% said they use fax to share PHI, and 16% said they couldn't actually easily access protected health information. So let's talk about health information exchange. How does that sort of occur? And then we'll talk about how fax fits in. So in this diagram, we put the primary care physician in the middle. This is because a lot of individuals will go see their primary care physician first. that care physician may say, I'm going to send you to a specialist, or I'm going to write you a prescription, or I'm going to send you to a lab for testing. In all of these cases, in the pharmacy case, a prescription goes, of course, but in these other cases, a physician's order occurs, and something is sent to the lab saying you should expect this person to show up. Something is sent to the specialist, or maybe something is sent to the hospital saying you should expect this person to show up for a test or consultation or something. When that occurs, the protected health information must be exchanged so that when you show up, you can be uniquely identified and linked to the information that was sent. Typically, the care physician not only sends sort of information that uniquely identifies you, but also maybe a record or two to the specialist. They may send some test results or may send something that tells the specialist why you're going there. The specialist will see you, maybe do a diagnosis, and that information needs to go back to the primary care physician. So another health information exchange needs to occur. The same thing is true for labs and testing facilities. Information needs to come back. And finally, primary care physician has to exchange or send at least PHI to an insurer in order to request reimbursement when you're covered by insurance. So how is fax used in healthcare? A couple of years ago, almost 3 years ago now, in something called the Markle Survey on Health in a Networked Life, 61% doctors said that the fax machine was their predominant means to share information. Now, lest you think that that would have changed in the last 3 years, just last October, a National Physicians Survey revealed again that fax was the primary form of communication for 63% of physicians. And so fax remains a very common way to exchange health information. We do that because it's a point-to-point. You get a delivery confirmation at least from the fax machine on the other end, and so it's considered fairly secure, and so it gets used significantly. Plus, and everyone has a fax machine; it's ubiquitous. So, what kind of information gets exchanged? I mentioned some of these when I was talking about the diagram. Things like lab results and physician orders, prescriptions, and admittance documentation and patient records and accounting sort of stuff, payment and remittance advice and claim status. All of these things get exchanged via fax. So I want to talk briefly about fax machines versus fax servers, or fax software. And the reason I want to do this is because many doctors today are using fax, and they're using fax machines, and using a fax machine can sort of be a problem or a pain. So let's talk about why. One is if you have to maintain these fax machines, you have to buy, whether it's paper or toner or both, or get them maintained to make sure they're always available and running. You have to work on the telephony that's connected to it, so you need phone lines to your fax devices. You need to make sure your phone lines are stable and consistent and reliable. You need someone to sort of manage all this. Fax machines, but more importantly, I think, fax machines don't have any ability to really integrate, whether it's to software that you're using now as more and more physicians are adopting electronic medical records, or it's integrating into things like a voice over IP network that's becoming more and more common in today's telephony environment, that we're ignoring the phone lines until we get to the edge of the network. Everything that occurs inside the office is what we call voice over IP, which means you're actually using a standard network connection to your phone, do your networking, and then there's a translation somewhere at the edge that translates from that network connection to a phone connection. Another key problem with fax machines is the notion of a consolidated audit trail. In the example I gave earlier about the breach, one of the reasons it went on so long is because when they discovered that somebody was sending out these faxes, they didn't know who. And the only way they could figure it out was to go audit manually every fax machine in the hospital, right? So they basically literally had to And most of these fax machines, if many fax machines don't even have a way for you to download this information. You just have to print it. And so then you have to go through, figure out what's the right phone number, what is the phone number I'm looking for, how many times did you get faxed to, what time of day did that happen. And of course they had to check many fax machines because they had to figure out which one it was that was even sending to that number. So no audit trail, and of course no centralized control of the fax activity. If you have the notion of having a fax account and have to send from your account, then you have an audit trail, not only that which faxes went in and out into which number, which could be queried on, but you also have then a record of exactly whose account that fax came from. So on the other hand, we have fax software available. Fax software has some hard dollar ROI because you take out fax machines. You don't at least have to run phone lines to all your devices. You only need them in your server room. And frequently our customers consolidate phone lines. They don't need as many in order to be able to handle the traffic inbound and outbound. It improves your ability to prove compliance and manage security because now everything is centralized. You have an audit trail. You know who is sending what faxes. You can do queries to, if you know a number has been sent to and that was a mistake, you can query on that number, see if it's ever been sent to before. You can also then reduce your overall IT management costs. And finally, very, very important, using fax software, you can integrate faxing into applications, whether it's on the back end, which we would call things like your accounting system or your EMR, but also it can integrate into your desktop. So a document that sits on a desktop can be faxed directly without ever having to print it. So where do fax servers fit in healthcare? Back in 2010, IDC Health Insights did a white paper on the role of fax servers, and they believe that it's very important for improving compliance, reducing the generation of paper, creating more efficiencies in sharing information between departments, and automating requests and bill management. So let's talk about a specific solution, in this case the RightFax solutions. RightFax is a software-based fax server. It can be deployed in several ways. And so we offer sort of what's the most typical, I think, is the on-premise server connected to your telephone system or to your internet provider. It supports connectivity to traditional analog phone lines to digital phone lines, which we think of as T1s or T3s, or even IP-based telephony environments. So if you're using voice over IP within your organization, it can support fax in that same environment. A second deployment model or option is what we call hosted. That runs in an OpenText data center. We run an isolated instance of the fax software. That instance is dedicated to you and locked down to you. We manage the servers that it's running on and all the telephony connectivity. We connect it into your network so it looks like it's part of your private network, and you have full control over the configuration and access to that server. And finally, we have what we call a hybrid option, which is a combination of the on-premise server, so you get all the features and functionality of RightFax, but we provide the telephony as a service. And so OpenText, you basically, instead of configuring the hardware that talks to the phone, you just configure an account that talks to our service, and we handle all of the transmission of the fax, both inbound and outbound. We offer extensive back-end integration options. There's a significant number of EMR providers that have pre-built integration into RightFax. We'll have a list of some of those in a minute. And the RightFax solution is extremely flexible, highly configurable. You can make it work exactly in the way you want it to function. You can tighten security way down. You can control who has access. You can basically even do things like designate that certain people they can send a fax, but it has to be approved by someone else before it goes out the door. And so that we have a lot of security controls available based on your needs. And finally, it's very scalable. There are extensive disaster recovery and high availability options. We sell configurations that allow you to do failover and hot and cold swap and that sort of thing. We also have an additional module that I want to talk about, and I think it's relevant to healthcare because we're talking about exchanging protected information and the importance of security. And so we have this module that is an add-on to the RightFax server. We call it the Secure Docs module, and it actually adds the ability to take something that's been scanned as a fax or set up to be a fax, and instead of sending it over a phone line as a fax, there's three options for sending that document. One is we'll turn the document into a PDF and we'll encrypt it, and then we'll send it as an attachment to an email address. And so you can send it from any of the user interfaces that we provide, desktop, web, Outlook, Notes, or Production, which would be your EMR system. But you can send that document as an encrypted PDF file, and then separately you inform the recipient how they can, what the password is to get into that file. The second delivery method is what we call certified delivery, and in that case we don't actually send the file to the user. You send an email to the user, to the person you want to receive it. We store the file on the server and on a web server that you configure, and you can deliver any kind of file in any native format. And when the user can then log into that web server, view, download the file, and our server then can track delivery and basically provide an audit trail that includes confirmation that the file was accessed. And then finally, we can combine both of those together, and so we can encrypt the PDF so it's on the web server, send an email. The user has to both log in to access the file, and then they have to have the password to actually decrypt the file. So some options for very secure file exchange. So how does this fit in a healthcare environment? This picture is just designed to sort of show that we have a server here that's labeled OpenText RightFax. It's on your network, and so from any system that lives on your network, you can send and receive faxes. And so from your billing and claims system, from a nurse's workstation, or from a department, from a multifunction device that's sitting on your network, from an electronic medical record, you can send faxes out, and the server converts them into the appropriate format, sends them over the telephone line, which is the PSTN. Inbound faxes sort of work the same way. They come directly into the server, and then the server can distribute an electronic version of the fax to a list based upon the fax number. It might distribute them all to one person who then forwards them to the right person. It could send them to the right department or to a specific email address based upon the inbound fax number. And so a quote from that Frost & Sullivan white paper that was mentioned earlier, they believe that the value proposition of enterprise fax services, particularly fax servers and fax over IP, is clearly identifiable, demonstrated, and proven. So I talked a little bit earlier about the fact that many healthcare providers or healthcare software providers have integrated RightFax into their healthcare system. This is just a list of a few. In the case of Nuance, there's 3 or 4. They have a dictation software that it works with, as well as a system for recording radiology reports that integrate with RightFax. Many of these other ones are EMR systems that integrate with RightFax. So let's talk about benefits. I got these benefits from one of our customers in talking with them about their experience implementing RightFax in in their, basically their set of clinics that provided healthcare services. So a couple things that they got out of implementing RightFax and having a fax server. One that they thought was really important. Overall, these fall into the category of improving productivity, but one they thought was really important was it reduced busy signals for inbound faxes. And so they felt that if their fax was busy, if a referring physician was hitting a busy signal, rather than keep trying, they would frequently refer to somebody else. And so they were losing some referrals. The physicians were happier. They were able to respond faster by always having an open phone line. The other thing was, using the fax software, they were actually able to schedule some outbound faxing at night. And so, again, they were able to plan the volumes a little bit so that they kept fax lines open for inbound and scheduled a lot of the outbound referral type traffic for night. If something was urgent, they could send it right away, but otherwise they could schedule it to go out later. No one had to wait for faxes when they came in. There was no stack to sort through. There was no manual delivery, no paper involved. So they increased productivity because they were able to fax from their EMR, from the desktop, from multifunction printers, and they reduced their use of paper, toner, and fax machines and phone lines. The second benefit that they saw was improved HIPAA compliance. They were able to reduce the number of faxes that were sent to the incorrect addressee, because in RightFax they were able to maintain a database of fax numbers, and so when they wanted to send to a particular doctor, they looked up the doctor and said fax to them, and it looked up the database phone number rather than having someone have to type in phone numbers all the time and misdialing. It gave them auditable accountability. They knew which faxes were sent and received and when, and they had a digital archive of all their faxes because RightFax maintained that for them. So they were also able to ensure that confidential information inbound was distributed exactly to the person who was intended to receive it without anybody else being able to view it. So it acted as a centralized communication hub for them. And they actually did use some of the options for encrypted and certified delivery. Last benefit is that of improving patient service levels. And this is very important for people in healthcare because most people who come to a healthcare provider have a choice. They can choose who their doctor is. Can't tell you how many times I've talked to people who have been given a referral, right? And they go to their referral appointment, and the physician says, I don't have your record here, so I'm not exactly sure how much I can do. I think I can talk to you right now, but we're gonna have to schedule another appointment. So one of the things that using this kind of system can do is remove some of those delays. This is the last bullet. Reduce some of those delays where the referral was not sent in a timely manner, it wasn't received. Sometimes that happens because referrals are put in a pile. Those faxes need to go out at some time. Staff gets to it when they get to it. But if you're doing this electronically, if you're sending directly from a patient record, you can eliminate those delays. This can accelerate scheduling and follow-up and claims processing so that physicians get paid faster. And it just improves both the tracking of the information, the storage of it, because everything's maintained electronically. You're not producing paper and then having to scan or anything. And it enables the fast retrieval of health-related information, even if what we're trying to retrieve is the picture of the fax that was sent for viewing. All right, so why OpenText? This is about OpenText, the provider of RightFax. We have been an enterprise fax solution and fax server vendor for over 25 years. Significant experience in healthcare. We are ranked by Davidson Consulting as the #1 enterprise fax server provider. We are also ranked as the #1 cloud fax vendor. We have, in addition to RightFax, we have a cloud-based fax service called EasyLink. And we are the fastest growing provider of fax over IP solutions. We're part of a large global billion-plus sized company that specializes in enterprise information management, and we're part of a group that focuses on information exchange. We have over 100,000 fax servers implemented worldwide. Over 10,000 of those are used in hospitals and clinics. And so with that, I would like to turn it over to Kent, who's going to talk a little bit about our sponsor today, Diem.
Thank you very much, Greg. Great stuff, and I appreciate you sharing that with us today. As Greg said, I want to take a brief moment to fill you in on who we are. Again, my name is Kent Bishop, and I'm with Diem Technologies. We've been a reseller of RightFax since 1993 and been in business since about 1990. In fact, I think we were one of the very first RightFax resellers out there. So we're very familiar with the product and have been working with it for several years now. We are considered an authorized support provider of RightFax, and there's not very many of those out there. That basically means that we take first-line support, technical support, for the product, as well as offer a lot of training and things like that as part of your support contract through Diem Technologies. So all RightFax support customers of ours have access to our free admin training that we do once a month or so here at our offices in Dallas, Texas. So as I mentioned, we have a high level of implementation and integration as well as customization expertise and experience. So working in the medical field and healthcare, integrating with EMR systems or other back office systems, that's something that we've had experience with. So we're a good fit there. And again, as I mentioned, our training center here in Dallas, I think that really sets us apart because of our ability to help our customers be successful with RightFax and so on and so forth. I don't see any questions in the chat box, so it looks like I guess there's no Q&A for today, but if you need to get into contact with us about any questions from this webinar or about RightFax in general, or maybe just, what's the best fax solution in general for me, we definitely have fax experts here that can help you out in that area. You can call us directly. A very nice woman named Michelle will answer the phone at our 972 number. You can drop us an email at sales@diem.com, or you can go on our website. It's just diem.com. We have a blog as well that we try to update frequently, and we're fairly active in social media. So if you follow us on Twitter, like us on Facebook, find us on LinkedIn, all those sorts of places. I think we do a pretty good job of sharing relevant content with our followers, and we try to add some value there. So other than that, I think we're pretty well set. Again, feel free to email us. We recorded this webinar session, so we'll hopefully have that available if you wanted to share it with colleagues or others that might find interest in the topic. We'll try to have that available and email out to everyone who signed up for the webinar. But other than that, with no questions, we'll go ahead and wrap it up. And thanks again for taking the time today. We hope you found it very informative and enjoyable. And again, any questions, you know where to find us. Thanks, everyone, and have a great afternoon.